क्या बात है हिमांशु? अभी तो ओटी से आ रहा है क्या?
बता रहा हूँ कुछ काम
अभी
करा।
लाइव
ट्राइंग टू शो ऑफ।
Are we live?
लाइव
Yeah. So, good evening and welcome to this 87th episode of All India Postgraduate Teaching Program, an initiative from ARC iOS. As usual, we have been different. In this new year, since we had a new batch which have joined various postgraduate courses in various institutes, we thought we would begin the month of February with how to write a thesis, how to select a thesis. So, in the month of February, we had about thesis writing 4 episodes. In this month, we are having on soft skills. This is a brainchild of our ARC South, Dr. Srinivas Joshi, member ARC South. Srinivas Joshi, it's a brainchild, and he is ably supported and guided by Dr. Kirti Singh. So, in this month, we had 2 episodes till date. Today, we are going to have in this soft skill bootcamp the episode which is titled as Breaking Bad News, Telling Tough Truths with Compassion. So, without much ado, can I request our Dr. Srinivas Joshi, member ARC South, to carry forward the proceedings?
Thank you. Thank you, Dr. Prashant sir, for giving us this opportunity to conduct the soft skill boot camp. Good evening, everyone. Once again, welcome to this special webinar series. And ably, I was guided by two important people, that is Dr. Kirti Singh and Dr. Kaushik Murli, who have been helpful and resourceful in moderating, in crafting this whole entire 4 series. So with this, I welcome our expert panel. Dr. Harbansh Lal sir needs no introduction. He is the past AIS president. Welcome, sir, Harban, sir. And then we have the Women Ophthalmic Society, with whom the whole thing has been built upon. I think she will be joining back because of the bad network. And we have another experienced person with us, senior ophthalmologist, Dr. Basin, sir. He's also joining us today. Thank you, Basim sir, for joining this. And we have three stalwarts, Dr. Krishna Prasad from MM Joshi Institute, Hubli, who has always been a role model in counseling, especially for the postgraduates, because teaching is always in his blood, and he keeps teaching up till 10 o'clock at the night. And so thank you, KP sir, for joining us. And the another, we have a star surgeon, who is Amitabh Bachchan, of ophthalmologist, Dr. Himanshu Mehta. So he'll be speaking to us about counseling the distressed celebrity patients. I think this is the hot debate topic of the hour, because we see some of the celebrities are leaving India and going for simple surgeries as well. I'm sure that Himanshu sir will bring all of them back and then operate and show what India is to the world. And we have Dr. Kaushik Murli, again, very stalwart. He has always been both into ophthalmology and in non-ophthalmology, very innovative ways of thinking. And he'll be talking to us his favorite topic, the how to build your brand and how to maintain your brand in case of crisis management as well. And that has been his favorite topic. And he has given various lectures elsewhere also. With this, we welcome Dr. Mohita Sharma, ma'am. Madam, you are able to hear us now?
I can hear you.
Yeah, good. So welcome to this presentation and on the soft skill bootcamp. So why we need this? So many people were asking why did we do this topic at all? The Joint Commission of United States estimates that 60% of avoidable adverse events are specially due to communication errors. So in the first series, along with Dr. Kirti Singh, we conducted how we can do the counseling in the postgraduate point of view. So we tried to see the northern flavor, the southern flavor, the western part of India and the eastern part of India. How do they counsel given a single case scenario? So that was very effective, and we did the first case series. The second one was, we know that the vandalism is increasing. That on the doctors, it is more and more happening. So how to curb this vandalism? So we had Dr. Sujata Rathod from Minto, the chief of Minto and director of medical education, from doctor's point of view. And then we had additional commissioner from Bangalore, Dr. Vikas Kumar Vikas, how to seek the police assistance in case anything happens, anything breaks out, then who is the first person we should ring? It's not 100, it is 112. Actually, we just got to know it. I don't know if others were already knowing it. Pardon my ignorance on that. But definitely, he gave a very important light on how to approach the police and when the police, how and what the police should approach us. And then we had a Union Council member, the advocate, senior advocate, Mr. Hallikeri, and who said that to read the Jacob Matthew case, that any doctor cannot be arrested nor an FIR can be filed until and unless the special committee is set up. So we need to distribute that Jacob Matthew case to all of them. It's a very important Supreme Court ruling which has shown that how doctors are protected by the law, but unfortunately, due to some political interference or some any of these gundagardis, that things are not happening, and still we are getting succumbed to these small things. But another important point, just we need to know is how the things have been treated to the doctors nowadays. So what happens, what the society expects, that the physicians will be competent, skillful, ethical, humanistic, altruistic, trustworthy. So I always keep telling my fellows, the relationship between the medical profession and the society or the patient is called as the social contract. But the changing trends in the healthcare profession, what is happening earlier, the doctor used to see the pulse and say, and everything used to get, that was the complete autonomy which was given in earlier years. Nowadays, we have altered public perception, because of which constant scrutiny and the lawsuits are happening. And studies from the West actually have shown that the students who demonstrate unprofessional behavior during their undergraduate or postgraduate days are more likely to be found guilty of unprofessional actions by the monitoring boards after they graduate. So fortunately, the Medical Council of India, that is the NMC, has now started this professionalism in their undergraduate, but still in the post-graduation and people who have already crossed upon it. So how we need to act upon these subjects. So that is the main role why we are here today. And the first topic will be dealt by Dr. Krishna Prasad on how to break the bad news. There is also a subject called as patientology. That is, we need to tell our patients how to become better patients. So apart from that, breaking bad news also is a very important aspect. So on that, I think we'll first hear from Dr. KP, and then we come to the next topic is how to handle the distressed celebrity patients by Dr. Himanshu Mehta sir next. So first, I'll be starting with Dr. KP. Over to you, sir.
Thank you, Dr. Srinivas, and thanks, Dr. Prashant, and the entire ARC for this great initiative. I hope this program will really reach its heights in enlightening all the postgraduates and even the practitioners alike. So the topic is quite a very important and interesting one. Unarguably, endophthalmitis is probably the most demoralizing and the most distressing event for any cataract surgeon. Okay, in their lifetime, probably this is the most nightmarish situation that they will actually face. But actually, ironically speaking, no surgery can be done without a possibility of an infection. Post-op infections happen in any surgery, and sometimes it is not because of the surgeon. There are a lot of surgeon-independent factors, especially if you take cataract surgery. There can be patient factors, patient's adnexa, it can be patient endogenous endophthalmitis, and a lot of consumable that we use in the eye, they may be actually contaminated, which is not the mistake of the surgeon. So even if the best care, best sterility practices, and the best aseptic precautions taken, still there can be infections that can happen. So zero endophthalmitis is not a possibility at all. But even then, whenever such a thing happens, every cataract surgeon feel distressed, feel agitated, feel depressed, feel guilty of all the things. And we always take a defensive role, a back seat. And in this deplorable situation, we start miscommunicating. The people don't tell the words that they need to utter, and they tell things that they should not be told in this altered state of this balance of the mind. So that is exactly where my topic comes in, keeping the young ophthalmologists, especially postgraduates, in mind. Let us try to decode how to handle a case where there is a suspected endophthalmitis in a post-operative situation. Let me share my slides. Can you see my slides? Sunil?
Yes,
Sir.
Okay, right.
You can do
So
a
this is
screenshot.
Okay.
Yeah.
So the counseling and communication in case of an endophthalmitis. So basically, do we really train our residents? Are they good in counseling? See, if you really look at the roots of a poor communication or a bad communication, we see so many situations where our residents don't communicate well, patients are not satisfied. We may create even a mob situation sometimes because things go wrong at many of the OPD and OT situations, because there is no curriculum as such. People don't read and write an exam and pass anything in communication skills, even though the new education policy has brought in medical curriculum some aspects of communication, but there is no hard and fast stress on this. And more importantly, there is no hands-on training. There's no dry run. I remember Dr. Kirti Singh doing a lot of experiments in her medical college situation, which right now is not universally practiced. So a lot of people actually do not really know how to actually express, okay, either the prognostication or the basically how to actually break a bad news or how to really explain the situation to the students or the patients. And more importantly, especially in a resident situation or a postgraduate or a fellows, normally they will be studying in a different state apart from their mother tongue or Hindi or English. So they may not be able to very effectively communicate in the local language when the patient is not able to speak any other language. They may even have vocabulary issues. So there can be sometimes some kind of a wrong communication that can actually lead to problems, or they may not be able to really choose the exact words to really make the patient understand the gravity of the situation. And also, as a generation, the present generation have poor social skills. I think everybody agrees on this. They are more into themselves. They don't really, their social skills are not very great. They are socially awkward. And also, some students may even lack emotional intelligence. They may not really empathize. They may not actually have the necessary body language to really compound there or to basically support the communication. So there is both verbal and non-verbal communication goof-ups can happen with the resident. I think this is something that we as a society have to really concentrate so that our postgraduates will have a brighter and a safer future. And communication is a forgotten soft skill. I think we need to really reiterate this. And it is said that the good communicators always get into less trouble. It's always like that. So Broca's area is what is very important, as it's said. And however surgery, I mean, however good you are a surgeon, you are, whatever is a surgical outcome, it has to be compounded by the way you communicate. The patient has to really understand what he got, what value addition he got. So if you really do not communicate pre, intra, and post-op properly, then the patient may probably think that he didn't get a good deal. At the same time, any minor problems, minor complaints, so-called the adverse effects, side effects, has to be taken care by a good communication, which actually should be taught to the residents by the veterans. So about the bad news, see, always things go wrong. Patient may come with some problem which has an effect on his quality of life and quality of vision. There may be a serious sight-threatening or a life-threatening situation even. So how we actually articulate this to the student or to the patient and the relatives is an art by itself. There are a lot of scientific things in it. Now even communication is also a science, not just an art. So like, for example, if you have a case of retinoblastoma, let's say bilateral retinoblastoma, parents are so worried. Patients are it's even a life-threatening situation. So how do you actually break this news? Child may lose the eye. We may have to do an enucleation. Child may even lose the life if not taken care. So something like cortical visual impairment. There's a child with global developmental delay. Child is not able to see. They have so much of hope pinned on the child. Now the child can't see at all. Sometimes a young patient with a trauma, head injury comes with traumatic optic neuropathy, no PL, nothing can be done. And end-stage glaucoma, end-stage diabetic retinopathy. At the same time, you have surgical situations like they do a cataract surgery, patient doesn't recover vision at all. So it can be a poor judgment preoperatively. It can be something you never anticipated, or it's just that probably this patient is not happy with the kind of vision that he anticipated. Nucleus drop, complications, suprachoroidal hemorrhages, but very importantly, post-op endophthalmitis is something that is a hanging sword on every cataract surgeon. This is where we all feel very guilty, even though there is a percentage of endophthalmitis is a part of known post-op complications. It is in our textbooks. Okay, maybe it may be 0.3, it may be 0.1, but it is still there. The number of surgeons, surgeries happening are enormously large. So you need to have some endophthalmitis. So when that happens, so how do we communicate? I'm not talking about the science. We have two, I know Dr. Prashant and Dr. Srinivas are great VR surgeons. Any case of endophthalmitis, if it reaches them in time, I'm very sure the present technology and the present surgical skills of our VR surgeons, we are able to recover almost entire vision if it can come at the right time. Okay, so that's a different thing. But that is not the point. The point is how the art of managing it, the communication, the counseling, the overall non-surgical or non-clinical management of the case, which can actually create more heartburn, more problems, mental stress, even sometimes the loss of fame. The patient and the surgeon can be actually can lose all the reputation. Okay, sometimes it can be a medical legal suit. There may be penalties for that. So this whole thing can be is something that every surgeon has his own way of handling. See, endophthalmitis is not end of the world. Okay, so nobody need to really become really bend backwards for it and become so guilty for it. It's basically a necessary evil as a part of a cataract surgery career. It calls for both art and science. Science, of course, leave it to our VR surgeons, but the art is very important. Most important, there is nothing like a task. Whenever there's a severe reaction, not expected, don't have a wishful thinking that it is TAS. Every severe reaction is an endophthalmitis unless proved otherwise. Please fall in line, accept that, treat it as an endophthalmitis, and be energetic and be judicious and be fast. Because time is everything. If the cornea becomes hazy, if the wound gets infected, or if there's a retinal necrosis, then even a VR surgeon can't really help you. Okay. So at the same time, let us look at the patient perspective. The patient has come to me. I mean, I've charged the patient. I've done the surgery in good faith. The patient does not see now. The patient has pain. See, patient, the loss of vision, no visual recovery. It's a breach of promise. It's a social contract, Dr. Srinivas said. So it's a contract between me. He has paid, he has come for services, but the patient is now not able to see. That's a breach of contract, breach of promise. So patient has all rights to feel, agitated about the whole process. Along with that, he has pain, discomfort, all the problems. And also he thinks that I am not a good surgeon. So it basically critically, well, this is where we all feel very bad. I've done with great faith, but surgeon, we use the word called botched up surgery. The media very, very unscrupulously, mindlessly uses the word botched up as if it's a criminal intention of a surgeon. So there is no criminal intention. So this is where we need to basically, all youngsters should basically console themselves that there is no criminal intention. You are done in good faith. This can happen. Patient may at that point of time may critically evaluate your competence in terms of the outcome, the short-term outcome, but nevertheless, that should not be taken too much into the heart. So how to handle it? Please take care of them immediately. See, when you're running an OPD, let us say always keep your reception staff, okay, beware, your counselors, your OPD assistants. A patient has been operated 3 days ago, comes to the reception and says, I've been operated, I'm not able to see well. These are the buzzwords. Immediately, there has to be a red flag. This patient has to be taken care immediately. You may be handling a VIP, you may be handling an emergency, you may be busy somewhere. Okay, this patient, if it's not taken care immediately, then in the court of law, let us say, patient will think that I came losing my eyesight, the doctor botched up my surgery and I was waiting the whole day, nobody bothered. This will be held against you. You did not show enough, compassion or reasonable care when the patient came with the problem, came with this serious condition. Okay, so this can actually, so please take care of them immediately. Don't make them wait. It may not turn out to be an infection. Okay, it may be some simple corneal edema or something like that. But still, your staff has to, you may not know. Your staff may ask them to sit till the afternoon. So please sensitize them about this possibility and make it private. So obviously don't come out and ask what is the patient may actually openly say that you operated me, I'm not able to see. So he may probably, it may create more of a problem for you as well as for others. So make it private. Take him to one side, immediately attend to them. Show concern. No, be compassionate. That's very important. But at the same time, you don't have to feel guilty. You don't have to feel the panic. You don't have to bend backward just because there's a possibility of an endophthalmitis. Endophthalmitis is not criminally intended. Okay, it is not your work of your intention. It just happens. So this is something that you need to really take care. And every endophthalmitis can be treated. That is something that you should know. And there are some minor, small snippets I can probably give you with my experience. Please ask the patient, when did the blurring start? Okay. See, this is something very important. Whenever patient is not able to see, he is very, very aggressive. He thinks you're botched up something. You're not able to, you have done some mistake. Okay. I've paid the money. I should be able to see well. I'm after. So normally most of the present era of topical phacos or even with a good SICS surgery, most patients will see the very next day itself. Okay, the corneas are clear, AC is quiet. Most of them will be able to get reasonable vision immediately after the surgery. So patient does see something. Later, see, endophthalmitis for all postgraduates should know there is some kind of a seeding of microorganisms which normally thrive. They get an entry into vitreous cavity. They start thriving there. They start proliferating. They produce, then there'll be a reaction from the body. There'll be exudation when the vitreous opacifies. When the vitreous exudation starts, the vision drops. Till then, they have reasonably good vision, even though there are microbes in the eye. It will take 2, 3, 4 days, depending upon the virulence of the organism. So at least the first 2 days, patient would have seen something. So if the surgery is bad, the patient will not see anything from the time of surgery. Okay. Whereas in this situation, patient has seen for some time and then the drop has stopped. So if you probably in your conversation bring this point, you were operated on Thursday, you saw on Thursday, yes. You saw on Friday, yes. Saturday afternoon, you started the blurring. What happened on Saturday? So you create this, so let the patient understand that first 2 days he was fine. Then we started thinking, what happened on Saturday? You may ask him, did you cough? Did you sneeze? Did you rub your eye? Did somebody elbow you? Like, did you not put drops? So you create some kind of a confusion. Like, what did happen? What happened on Saturday that my vision started dropping? Something might have happened. The patient starts becoming less aggressive and start become more defensive and there is some contributory mistake from the patient also. Because so he start thinking there may be some other thing that might have caused this, not the doctor surgery itself, because he saw for first 2 days, right? So at the same time, never use the word. This is my most important appeal to postgraduates. Never use the word infection. There are some PGs who will also explain in local language, septic, pus, okay, all those things. No, patient asks what has happened. Always use the word reaction. Infection is also inflammatory reaction. So there's a reaction has increased in the eye. Never use because infection means it is pus. That means you're not probably taken good care. People do know about the sterility practices that post-op infections can happen. That's a doctor's, that's important that the doctor has not taken due care. So never use the word infection, always use the word reaction. At the same time, don't show too much of agitation and panic. And very importantly, if the patient is hostile for whatever reason, take it head on. Okay, don't just succumb to it. Okay, you have to be stoic, at the same time face the hostility. Show genuine interest. That is very important. You are basically interested in the patient welfare. Take genuine interest and don't overact also. You don't have to really show too much of, don't have to overact in front of the patient. Very importantly, there's an initially patient when you understand that something seriously has gone wrong. There's a denial, then there's agitation, hostility, and later the patient accepts. Most of the well-meaning patients fall in line. Hold on to your nerves. This is very important. Things will all get better. This too shall pass. This is the buzzword. And please believe our VR colleagues. I think Dr. Prashant and Dr. Srinivas will agree with me that we don't lose nowadays, patients' eyesight because of endophthalmitis, because there are such fantastic antibiotics, fantastic surgical methods, and there's an early, Now we know no more follow the EVS study anymore for the vision to drop so much. Now we can do an early vitrectomy and salvage the eye, salvage the vision. And think, all said and done, India still, many places, doctors are still revered and their words are taken care. If you really show enough compassion, enough care, due care, still if the end result is good, still nothing happens. Okay. At the same time, medical legal issues. Patient can go to court. You may see there are many cases in which the doctor cannot be held responsible. I told you there can be various reasons, unless there's a very stark evidence that you have gone wrong. Okay, you may still win the case, but it is still an unnecessary, unwarranted mental hassle. You end up paying your advocate too much of money. You have to go leave your practice and go away. And it's a mental harassment. We are not used to going to court. So try to prevent as much as possible. But in case we anticipate that, be prepared. Keep your notes ready. Keep your documentation ready. Most important, hire a good advocate. Just like good cataract surgeons, good VR surgeons, there are good and bad advocates. Try to choose the best advocate. Document everything. Law is the slave of documentation. It is a slave of evidence. You may have done all the sterility procedures, but it is not documented. Your OT is not made, aseptic precautions. There's no, OT documentation. You are not, autoclave cycle is not documented. Then obviously it is not done. What is not
So
documented?
time is up, sir.
Yeah, this is the last slide. So let's talk. So choose the right choice of words and phrases. Informed consent is very important. That will be discussed very soon. And very importantly, see, it's not a contract in terms of money. Patient has paid money, patient has to get back vision. It's a nobility of sight restoration. In this entire big scheme of things, these things happen. So don't try to refund the money, don't try to compensate. See, try to understand the big picture, and time will heal most of the things. Thank you very much.
Thank you, Dr. KP sir. It was quite elaborate. You have explained very nicely how to break the bad news, especially in case of endophthalmitis. My first question to Dr. Harban sir. Harban sir, we all know that delivering bad news is one of the most daunting tasks faced by the physicians. And for many, in fact, their first experience involves that the patient they have known only for a few hours. And given the critical nature of the bad news, that is any news that drastically or negatively alters the patient's view of her or his future. And this is hardly the recipe of success for the young budding ophthalmologist or the postgraduate. So how do we handle this breaking bad news, sir, according to your perspective?
I think as KP has said, first of all, you should never feel guilty and you should never be defensive. But at the same time, you should never hide anything from the patient. Because if I try to cover up, try to hide, patient can sense my lying to him. He can understand I'm not comfortable talking to him. And his sixth sense says something is wrong, his doctor is not telling me. So I am usually straightforward so that I feel relaxed afterwards whenever the conversation goes. So I tell the patient in the first instance that your eye has got a very severe reaction. We will like to treat you, but at times it is very difficult to differentiate from severe reaction and infection, which is very, very rare as compared to the severe reaction. So we need to be extra careful and we'll be managing you. So, and then we'll of course take the VR consent and as the weather things, I'm not going to the discussion, but at the first instance, if I got a doubt that patient may have an infection, and if I feel it's very clear fibrinous and it's a task-like picture inflammation, nothing to worry. But if a patient has got a pain and there is a vitreous cells and all, then I definitely like to inform the patient that there is a possibility of infection, but there is absolutely nothing to worry. We will be 100% able to take care of. So we'll give him the confidence and move ahead and inform him. And of course, VR surgeon will be seeing, and if required, injections or surgery, whatever. Usually early on, it is injection. If it is late, of course. So most of the time, injection works very well in these cases.
Thank you, sir. Mohita ma'am, what Harban sir said, I think is agreeable to all. But is it really all the time it works? Like all the time being so truthful? Because nowadays, the truths can be manipulated in so many ways. It can be taken in nowadays, that any comment we give, they take the half of that and then put it in a different angle. You know that. So what is your point or your take on this, madam?
My take in this would be that initially, whenever we come across such a situation, since we are talking about endophthalmitis right now, so it is important to break the bad news, but it has to be done in a very slow manner. We cannot immediately say that you have a infection or your, as Dr. KP very rightly said, first of all, call it a reaction and not an infection, because infection is something which is like a very negative word in the mind of the patients, and they feel that now they have an infection, so there is something very, very wrong. If we just say a reaction, then their reaction is also better to our word. And in fact, I must compliment Dr. KP, because whatever he has said, a lot of things we have not been taught, and this is not nowhere in the curriculum. It's nowhere on the internet, nowhere in the books. But yes, this is something which we all as practitioners learn by default, and I could connect with many of the things that he was telling us, because that is what all of us do. But yes, I feel that any bad news has to be broken in a slow manner, because there has to be we have to give them time for acceptance of that bad news. Yet we cannot be hiding, so it has to be in a very, very diplomatic manner, such that they suddenly don't feel it is a very negative news and they have lost their eye, and simultaneously giving them some hope also. And yet we know that initially there may be sometimes a reaction from the patient, where the patient may suddenly go into a little blame game kind of a thing. In such a situation, I always feel that what we call as empathy, and that needs to be shown simultaneously with all the treatment that we are doing. And in fact, here I want to emphasize that there are some, in fact, this is one of my experience which I share with everybody, that in the beginning of my career, I attended one communication skills course, which was related to how you have to deal with your patients. And there they told us some very important words in role plays. And that word was, whenever your patient is getting a little panicky, you just have to use the words, I understand. You should say, I understand what you may be feeling, and if I was you, I would also be feeling the same. Now, as soon as we put ourselves in the patient's shoes, as well as show to the patient that if I was you and somebody told me I had a severe reaction in the eye and this needs to be treated and we are not sure what the result is going to be, I would also react in the same manner. But then whatever is the best we are doing for you, and as soon as we use these words, it's like they start feeling that we are in it together, that the doctor and the patient are both doing it together. And I've seen that as we slowly keep talking a little more about it over the next 2-3 days as we are treating, then the kind of acceptance also comes with time.
But the only thing is, where 2-3 days? I mean, if you are suspecting infections, I will not wait for 2-3 days to really.
Yeah, we would tell the patient
so if
that.
you feel there's a reasonable amount of suspicion of infection, within 6 to 12 hours, we'll go in and do what is required to be done. Secondly, I personally feel that I feel more relaxed after breaking the news, because I inform the patient, I'm not hiding anything. I'm straight away guiding them what treatment is required. So, I mean, you don't have 3 days time to.
I agree with you, sir, that treatment has to be started. And simultaneously, what I only meant was that initially we don't put it in a very negative manner.
I just said the same thing. It is most likely reaction.
Yes.
But once in a while, it may be infection, which we need to be very aggressively. Even when I give injection, I tell them that it is most likely reaction, but I don't want to take a chance because the infection can go ahead. So even if it is a reaction, I'm giving you injection as a precautionary measure. Though I know even if I don't give you injection, you'll be all right, most likely. But I can't take a chance. We'll go ahead straight away. Though I think it is a reaction, but I'm preventing if by any chance it is infection. So even if it is a reaction, I will like, if I have a reasonable amount of suspicion of having infection, because we need to treat them very aggressively, I will not hold on the news unless I'm myself doubtful that I don't think it is an infection and it is most likely task. Then I don't have to tell them anything about it. Just treat them with these steroids and see after 6 hours or 12 hours whether they become better.
Can I
And one
say
more
Sir,
thing,
something,
one more
Dr.
yeah,
thing,
yeah.
Dr. Srinivas, I wanted to say another point that needs to be highlighted, which Dr. KP said was hold on to your nerves. Because I know that whenever any such thing happens, whether it is endophthalmitis, it's a nucleus drop, it's a IOL drop, or any such thing, many of our colleagues will ring us up, and they are in a very jittery manner. They don't know what to do, and they would lose their sleep also. So, an important message needs to go that this is a necessary evil. It's part of our profession. However good surgeons we may be, however best we may do, this will happen. So, holding on to your nerves and still sleeping well despite the complications and managing them well is what is needed.
Totally agree with your points, madam. Thank you. Very well said. Yes, Basim sir.
Yeah, but I think I want to add two, three things. One is that we should be compassionate and we should show our concern. Whatever patient is saying, you continue start doing the things what is required in that particular situation. Like endophthalmitis, you have to dilate the patient, you have to put the drops, keep antibiotic drops, you have to prepare for the injection, the OTP staff and everything, document everything, and all the investigation should be done. B scan, whatever is required, necessary, because they are the documents which is very much required. So, and fundus photo, that will give us the how much the haziness was there, how much, what is the severity of the infection at the time of presentation, what we have taken. So we have to be very compassionate and don't charge for whatever you are doing now. Maybe you can give drops antibiotic from your side. You have already charged from the patient. So to decrease the agony and to conflict between you and the patient and the organization, and all these things should be, communication should be done in a chamber where no other patient is there. Maybe one or two doctors, if it is required, that is also there. Or maybe you can cross show your colleague in the next chamber if it is necessary. Otherwise, you start doing whatever is necessary at that point for that patient. That will show the concern, and patient's anxiety and agony will also decrease with time in another 1 to 2 hours that you are working seriously hard for the patient's betterment.
Can I
Dr.
speak?
Basin, I think not charging can work both the ways. Patient may think that you have done a mistake and you are feeling guilty. So I think this has to be taken care, because we are surgeons have to do vitrectomy free of cost otherwise.
Okay. Can I add to it?
Yeah, please, sir,
Yeah,
quickly.
yeah,
I
yeah.
know in my practices, even if I am a VR surgeon, once in a while we can have our own cases which go into infections are not behaving the way we would like to have. And we have to let them know what is happening bad. So we need to phase it out in a different way. What I do differently is I would not reveal the whole secret in a go. I would just see at a clinical thing. I would, the moment he walks into my thing, I just do all slit lamp examination, and I would just nod my head, and then some small conversation, and then I would say, "Oh, it's not behaving the way I would have loved to see you today. Let me think. Let me think. Let me investigate you." So buying time and giving in a phasic manner, slowly surmount, means stepwise, the intensity or the gravity of the situation is important. So I would just say that, okay, they would come back with the question, what happened? What happened? I would say, no, no, let's see. Let me do that. Then I would do an B scan, though I know I might not need. I might do a OCT or a color photo, whatever, whatever. So that helps the patient to have certain feelings of sinking into their mind. And so another 15, 20, 30 minutes goes, he comes to terms with the current situation. And then I'd come with the B scan. Then I would do is I would just, if I see there a lot of corneal edema, let me also have an opinion of a cornea surgeon as well. So this way, the many a times it helps you in pacifying as well as help the patient to sink that gravity over a period of time. Over to you, Srinivas.
Thank you, Prashant sir. I think
Very,
we
very
have
good
two other
point.
important
Very good point.
talks here. We'll come back to the discussion because next we are going to how to handle it in a slightly different way. Because you are trying to operate on a celebrity and 140 crores, at least I think 100 crores will be following up that particular doctor. And then if something happens, then a person like Arnab Goswami will call and ask Dr. Himanshu Mehta. The India wants to know what happened to Amitabh Bachchan, what happened to Shah Rukh
Permission.
Khan. right? So these kind of questions can be faced. So how to counsel in such pressurized conditions? I know sitting here, Dr. KP was sitting under the air condition and telling these things, but under pressure, how do we do that? I think we would love to hear from a man who has operated on many of the celebrities in Bollywood. I don't know if anybody from Hollywood, but definitely in the due course of time. Over to Dr. Himanshu sir, the chairman of Vision Eye Center from Mumbai.
Thank you. Thank you very much, Shrikant. Thank you very much for inviting me here, Srinivas, and wonderful being with all the elite people here. What you said is very, very important. First of all, in a case like this, avoid the media. Never ever talk to the media. I've had media asking me questions about multiple number of people. The most important thing in life is never to talk to the media. It is a double-edged weapon. The worst mistake, if you saw recently during that murder.
Sorry, can you put it on a slideshow mode, sir?
Yeah, is it on a screen sharing? I am on a.
Just click the play above.
Yeah, play. Why is it not going? Or
So bottom on the top bottom, sir, on the toolbar there is a play button.
yeah, pause.
To left side, sir. Move to the left. There is a play button there.
Yeah, I'm looking for that. I'm not getting it. Otherwise, every time it happens.
Okay.
So sorry about that.
No
Share
problem.
video.
Just beside that. Just beside that.
Video. Participants.
Yes, sir. No. You just press that, sir.
Sir, you are on the Zoom toolbar. If you can just remove that. Yeah, this is the toolbar. Yeah, there is a play button, right?
So sorry about this. Play, yes.
Play slideshow. Yes, sir. Fantastic.
I'm so sorry.
No
yeah. So Srinivas, the recent case, if you saw that attempted stabbing of Saif Ali Khan, the full stupid team of Leela came. I'm at Leela, and they were so happy that the newspapers are asking questions, and they gave all the details, including the knife and all. It is the worst thing that you can ever do. Never ever talk to the media. It can be terribly against you. You think you're getting publicity. Nobody's bothered about you any which way. Everybody's going to forget you. But if you open your mouth and something goes otherwise, it is disastrous. I'll give you a live example of another point. Mr. Bachchan was operated 2006. Remember that major illness? And he was operated. And there was a general surgeon and an endoscopist who was there. He was there during the surgery, and next day he gave all details to the media. Within 48 hours, he was thrown out of the hospital. Yes. So media, you have to be very careful. It is a disastrous thing to talk to the media. I'll go further than that now. So be very careful. Media can really make or break you. Be careful of every word you say. You will be misquoted badly, and they would want to say something or the other. So you have to be very careful with the media. So that's the other story. But having said that, operating a celebrity, it is important to understand that you have a great sense of understanding. It's never a sudden one step. I'll do FACO, I'll do femto, I'll do mono, I'll do multi. All that is of zero significance to them. The whole game in life, as in marriage and otherwise, is the game of expectation. What is reality and what is expectation? You have to be very, very clear that their expectations could be humongous. And they have been given a lot of information by various people who don't understand the subject. Remember, quite a few of them have very weak ears. And they have people who always tell them, "Arey, bahut acha saab, very good, very good, very good." That includes politicians, that includes all top guys. Very few are used to criticism. Otherwise, those guys will never stay next to them. So be careful. Now, here is a very lovely clip which I loved. You know how this is to be remembered regularly. You are the small guy. There is a big guy going to punch you. You know that. How well you have to avoid yourself and when to punch at the right time is a very important statement. You know, you have to be very careful to protect yourself. Yeah, but you have to time it. You have to time it well. And this is something which we have to learn on a regular basis. And this is a lovely, lovely thing which everybody, including for endophthalmitis or every which way. Yeah, look at that. You know, you have to time yourself to see when you do what you do. So there is nothing like right and wrong. Be careful of every word you say. And every word has to be very clear. You have to make yourself very visible to them. Tell them what is going on. What can you do? What can you not do? Surgery is surgery. So biggest statement that I would put is very clear. Do not get overawed. Suddenly people like taking pictures, autographs, stand with next to them. Don't do that. Don't get bullied. They are used to getting so much attention that they can bully anybody anywhere. 50 photographers they can just throw in 1 second. They are used to throwing people in one corner. Never ever get bullied. Something which is very important on a one-on-one relationship. This is something which is to be learned, and a lot of people suddenly feel, you know, extremely overawed by stuff. So give due respect, but keep your self-respect. This is something which we kind of have forgotten. Suddenly they're sorry, you're this, you're that. Something, you give them respect. You have all respect. You're not insulting. You have nothing. Srinivas, how much time do I have? 10 minutes?
10 minutes, sir. Yeah.
Okay. So I'll just wind up. But important points of life that I would say. What has happened with cataract surgery and other surgery is we have demeaned ourselves over a period of time. अरे नो स्टेज यार, नो इंजेक्शन, आप कल शूटिंग पे जा सकते हैं, क्या प्रॉब्लम है? कुछ नहीं होता है, दर्द नहीं होता है, इंजेक्शन नहीं, पट्टी नहीं, आपको सब दिखना शुरू हो जाएगा. एंड ऑफ कोर्स अभी तो ये मल्टीफोकल आ गया, आपको सब दिखाई देगा. एवरी वर्ड विल गो अगेंस्ट यू, इट विल कम एंड ईट यू अप. If you have over promised every which way, you have said something which you don't want to, but just to be nice, we as doctors want to be nice. नहीं, सब अच्छा हो जाएगा, don't worry. Like classically in an ICU, no, the intensivist comes out and tells the relatives, kidney खराब है, liver खराब है, you know, the brain is almost brain dead, heart अच्छा नहीं function कर रहा है, we have to do this. And then somebody will say, ऐसा तो सब अच्छा है ना, there is no problem, no. This is the classical scenario. Everything, end of the day, it is the buck stops at you. So you better share responsibility. That if it is a brown cataract, you have an arcus, you have a bad cornea, you have this, you have that. You better say what you are meaning and what you have to say. So the most important part in any place, as Dr. Mohita said, what she learned, very important statement. She was taught and said that if I were in your place, what would happen? This is what, same way KP said, how to everywhere we are coming to this point of communication, something which is lacking big time. Looking into their eyes, not getting bullied, and talking to them sense. And they also understand. So counseling, take your time as much as you wish to. Don't be in a great hurry. Don't leave it to the counselors. Don't bypass that. It is important that the jigsaw puzzle will not be over unless you have taken your time there. I'm writing this again and again. And this day of distressed celebrity will not come if you have pre-operative counseling, which does majority of your job. So this is where a communication is set up between the patient. The most important thing is the communication channel between the two. And try and read their mind. Try and read what have they been fed information with. What is it there in their mind? What have they been told? What have they understood? Not necessary that all their IQs are very great. Remember one thing, you don't give them too much credit for that. They haven't done much homework. They've heard a few things here and there. So giving into their patient expectation is something a disaster. We all like to say, kuch nahi hota hai, sir, nothing, no redness, sab acha ho jayega, don't worry. So to me, I think that day should never come that you have somebody who's distressed post-op. Then it is very difficult to come out of that. But the game is won or lost. 80% of the whole game is before the surgery starts. Your surgery is maybe 20% of the whole game. What you have made up, what you have built up, what you understood, what is body language you have, who has the upper hand. Remember one thing, this is yours. You are the boss there. He is not the boss. She is not the boss. So you have to be very clear what decisions you are taking, why you're taking. Don't be cowed down by what they have to say. So never ever show that the glass is full up to the brim. Then there is problems of seeping over. Always remember that you have to tell them that cataracts is a game of expectation, LASIK surgery or whatever. What the patient demands, what they expect, and what the surgeons can deliver. There is a huge gap between all these three things. You are born with a big number, you have a retina problem, you have glaucoma, you have diabetes, you may be on tamsulosin, you may be on 100 other things in life. And you take all responsibility. Nahin, sab theek ho jayega. Don't worry about it. Explain the difficulties that you may face in diagnosing everything. Of course, you have no choice but to have the best of the equipments. Be absolutely aware of what is there in the world. There is no escape to this. Zero. You have to have like in case of a cataract surgery, your optical biometry, your K reading, your machine which you are used to. Another thing, never suddenly go and operate in a new environment. Patient relative says, "No, no, ye hospital mein." Don't ever do that. Don't ever go to with some other equipments. If you have bought a new machine, don't try suddenly. Don't try any new lens suddenly in this particular patient. What you have been doing in the past 100 cases, only do that. Do not do anything suddenly out of the blue. Be very, very, very clear in your mind. It's like just you're walking in and doing the same thing again and again and again at the spinal level. That's what you want. So listen to them. Very, very important. The relatives, the person who comes with them, they themselves, what information they have, try and read their mind. Very important. I've had a patient who started complaining about dysphotopsia almost 3 months after cataract surgery. When he started reading on the email, on Google, that there could be dysphotopsia. How many of you agree that before surgery, LASIK or whichever surgery, nobody ever does this? Nobody for 65 years or 70 years of life, they do that. And after surgery, they'll start comparing. What the hell is going on? Why is my one eye different than the other one? So make them see this before surgery. I make all of them see that before surgery. There is a difference between the two eyes. Something which you have to anticipate. That is very important. And as always, you have taken your defense, you have seen what is happening, you've taken all possible precautions, and everything is going hunky-dory, you are enjoying. But as KP said, yes, the trouble can come any time. But at any given point, do not. We have done enough, our colleagues in the past and even today, undervalued our own self. Most doctors, ophthalmologists, after 15 years of hard work and practice, still undervalue themselves in the mirror. I call it strangers in the mirror. Do not think that somebody else, the same person there, in whichever department, has not spent that much time. They cannot, even for next 15 years of work, they'll not be able to do what you are doing. Have value of yourself. Yes, you value them. They are great in their field. But at the same time, do not undervalue yourself. And the moment you show any kind of difference and disparity, you have lost the game mentally. The whole game is here. Everywhere, the whole game is here. And that is something which we have to be very careful about, that we remain stuck to the ground. We hold our ground well, like what KP was saying, that, don't lose your morale, don't lose your courage. Things can happen. You have to have a lot of nerves of steel at that time to look into their eyes and talk properly and tell them what is going on. So if they undervalue your surgery, you don't have to worry about it. Let them go somewhere else. And yes, they have been fed with many information, with some in Tom, Dick, and Harry. Learn to say no. They will respect it. We are worried that, if you kind of counteract their thought process, they will not like it. Vice versa. Learn to say no. You must learn to say no, when not to do, and what I can do, what I cannot do. So, pre-operative time, less before surgery is equal to more chair time post-operatively. And that's something where, again, at any given point of time, pre or post, honesty, clarity of answers, no ambiguity, look into the eyes and answer. And when somebody is saying, like classically in a monofocal, multifocal scenario, they all want full vision. They all don't want to wear glasses for vanity and for all other sakes of life. But if they say, nahi, ye hoga, I've heard my friends are not very happy. Sir, don't do it. Don't do it. Just tell them. Use reverse psychology. You don't have to fall into that prey. You have a problem. We are trying to get rid of it. This is not luxury. This is a necessity. I'm trying to get you out of that trouble. So under-promise. Unfortunately, being doctors, we are very nice people, and we kind of always want to say, no, everything will be fine. You'll do everything. You'll read everything. You can go back to work very soon. Never make them underestimate the procedure. This is very important. And don't neglect. Don't make them sit if somebody has trouble. Again, time and again, I'm trying to show you this, that yes, every which way, we have to be careful with them. It's a double-edged weapon. Hold on to your ground. They will be with you. They will surely counter-check you. But if you lose your confidence, the last thing that you want is they will chada on you. So don't waste your time by showing things which are going to make difficult for yourself. I think I would invite questions from you, Srinivas. Enough that I mentioned.
Thank you, sir. I think you were really very straight, and I think I should not call it as blunt, but definitely at times when required, then we have to be really straight in answering many of these questions. So I would like to open the questions for the
I'll show you a
panelist.
clip. I'll show you a clip with Mr. Bachchan once in my daughter's
Yeah.
wedding,
Hmm.
saying clearly to the crowd that I prefer Indian doctors and I have a lot more faith. So even I can afford to go outside, and these are his words, quote unquote. I'll show you a clipping. I generally don't like showing all this, but I'll show you a personal clipping. And he has to be respectful of that, and he is respectful of that. End of the day. I'll give you my personal example. This is something which I would, it was COVID time when I operated this one eye. और वो शायर के मूड में आ गए. उन्होंने कुछ लिखा, अंधा हूं लेकिन ऐसा वैसा कुछ nonsense he wrote down. And of course, a lot of friends from the country called me up. Okay, you goofed up, some happy, some unhappy. Whether I had goofed up or not. Very interesting what happened, what was going on. And then I had to tell him on his face, so you can't ruin like this. You can't be talking like this. In your शायर नहीं डॉक्टर साहब ये तो मैं सिर्फ शायरी कुछ लिया मैं बाबूजी की याद आई तो कुछ मैं कविता लिख रहा था अरे तंबूरा कविता. So next day he wrote, he tweeted that if I could not see, how would I be able to write? If this doesn't happen, will be messed up, no, for no rhyme or reason. This is sharing my personal heartburn. I've never talked like this before.
No. That's what we like, sir. That's why we had you here. And because this is being watched by many practitioners, not just postgraduates. I just got a review in the last this thing also, because majority of the time postgraduates do not really know that it is how much important these things are, unless they start operating and they start counseling and they start getting into this VIP mode or the VIP patients. That is when their testament starts. So, but very nicely said. Thank you, sir, for that
Just 2 minutes
brave
more.
comments.
On 2 minutes that I will just take on something more important. Another celebrity patient who went abroad for treatment. You know who I'm referring to.
Yes.
Now it's a classical, if Harvard has to write a strategy for disaster, that is the strategy for disaster. Exactly opposite to what I said has been done. Somebody saw the patient, somebody else operated in another hospital. Now, without building a rapport, without making them understand what you have done, what you are doing, what is planned, and which patient, second day, third day, is going to be unhappy that nahi mujhe zyada dikh raha, aisa dikh raha, waisa. Don't cow down to that. There was no rapport built up between that surgeon. I have excellent surgery, a great surgeon, good colleague. But see how the recipe for disaster happened. Because the big ma'am from the big house in the Shadi, okay, Gauri had come and met me 1 week prior to that. Sat with me for 1.5 hours to discuss what surgery and what to do. Somewhere the big madam forced them to get it done at the big hospital. Now imagine a younger guy with difficult body language to go ahead and do surgery. I told you 80% of the job is not surgery. 20% of the job is surgery. And that's where the unhappiness crept up. And then we can justify everything. And then he went back to his previous surgeon who had done LASIK on him 10 years ago, which means, first of all, this patient is not faithful to you. LASIK somebody else had done, somebody else. So they don't deserve any great mercy from any of the doctors. So that doctor said that the LASIK operated, that very smart. He also gave a lovely answer. Now he's also bugged. So he gave an answer ke, nahi, yahan nahi hoga, sir, India mein, you have to go abroad and get it done. Saved trouble for a lot of other people. But this is how, if I have to put it piecemeal, because this is a question I'm asked many times. I don't open my mouth. I keep totally shut. But on this platform, when we are teaching something where build a rapport on one-on-one basis, it cannot happen overnight. Give them time to sleep over it, think about it. Don't rush into it because the third party came and pushed you into it. You suddenly you lost value of yourself. You are just one more electrician who came and fixed the bulb. Nonsense. If that day comes, you have ruined yourself. You ruined your own value and your respect. So you're not one more carpenter. Remember one thing. कभी भी लाइट जाता है तो यार वो इलेक्ट्रिशियन था ना, वो प्रकाश, वो बहुत अच्छा था, उसने टाइम में करके दिया था, उसको ही बुलाएंगे आप, और उसको कभी याद नहीं करोगे आप उसको. Remember this car mechanic. I'm not kidding. These are live, true examples of life. Car mechanic. That guy, I went to 4 guys, but they were not very good. This guy in 1 second started my car. That's all. So we don't want to be used like that. Don't abuse yourself. Don't let anybody use you like a football.
So I want to make a
Psychiatrist.
comment, Dr.
I
Srinivas,
think
if
he,
you
he
allow.
should have additional degree of psychiatry also, madam. I think public speaking, psychiatry, I think many other degrees, which I think Dr. Himanshu have earned without actually passing the entrance exam on those subjects. But definitely you have passed in the real life exam, sir. Very well said. Yes, Mohita, madam, your comments, please.
So one point that he said was very, very relevant, which I also want to emphasize and share, that though not as much as him, but I operated a few politicians and few celebrities. We all do at when we reach this stage of life where we are 25 years plus into private practice. So when they come to me, like what he said was, don't ask them for photographs, don't ask for them for autographs, because once you do that, I also feel that you suddenly bring yourself down at a lower level, whereas in your place you are the boss, and you have to maintain that dignity and you have to retain that self-respect. And as soon as you start asking for photographs or autographs, you are one step down automatically. So in fact, I do this with my hospital is filled with a lot of photographs of me with the patients, and I do this with my common man patients, where I sometimes tell them, come, let's have a photograph with you. So in fact, one of the politicians, he asked me after the surgery, you have so many photographs, you don't want a photograph with me? So then I said, if you want a photograph with me, then I'm most happy to have a click with you. So it's not that we should not put them at a level where they start feeling that they are the celebrities and we are, like, as Dr. Himanshu said, some electrician or or somebody who just came to fix their this thing.
So I wouldn't expect anything vice versa, Dr. Mohita, from you.
I don't know whether that's a compliment.
It's a compliment, 200% compliment.
That's a thought. Okay, thank you.
Thank you, Mohita madam. Quick comments from Basim sir and Harbans Lal sir. We have another important talk on what Himanshu sir and Mohita madam was talking about, is how to build your brand reputation after building. If any such incident happens, how do we still maintain the brand? Because as Dr. Mohita madam rightly said, that the celebrity themselves should ask for the photographs. And looking at the brand itself, what Dr. Himanshu said, looking at the brand itself, sometimes most of these celebrities, most of these politicians, I think, will come online or will try to understand what we mean to them. Quick comments from Basim sir and Lal sir, please.
So, 1 second, but I really appreciate the way Dr. Himanshu has explained. And what I personally do is I explain everything to the patient beforehand. He has arcus senialis, he has brown cataract, his cornea is not good, or whatever may be the things, and posterior polar cataract, whatever shortcomings are there. And even if it is not there, we tell them surgery is surgery. And we have to be very patient. And during the surgery, cooperation is very much required. And as he said rightly, under promise, over deliver. That is what should be always be there, and give time to the patients, such VIP patients, these all doctors and all those patients, and ask them, this is what I am planning to do. You can think over it. This is what is expected, the outcome from your surgery, and this is my experience. You decide and let the patient come to you for the surgery after a later date, whenever he wants. Or if he wants, he can get. I still remember I asked In my early days, I think 25 years back, one senior doctor from the nearby capital was there, and he came to me, and I asked him, I can fix appointment for, I mean, for AIMS and for other cities for you. And he came after 1.5 months, and then we performed surgery. So this is what this thing is. Thank you, Dr. Himanshu. And we are late, I think. Thank you. Thank you, Srinivas.
Thank you. Thank you, sir. Lal sir, any comments or we'll go to the next?
I think Himanshu has covered everything. I think beautifully covered and very nice talk. Only thing I think what Pranav Bhasin was saying. Now, whenever there is a heart cataract, a small people, I write for the counselor, Visco, Malvin ring. So then the patient asks why. I mean, then they know there's something, some problem is there, and why doctor this is needed, because your eye is tough and it may take some time for you to recover. This is to protect the cornea. So they become little negative if they have delayed this surgery. So just charging little extra for some putting some extra material. So I think that just conveys the message.
Great. Thank you, sir. Thank you. So we have the last talk. Is any untoward such incident in case happens, like how we need to solve the crisis, how we need to face the crisis, that is the crisis management, and how we can still maintain or build up your brand reputation more from that will be spoken by none other than Dr. Kaushik Murli. He has also done his MBA degree from INSEAD from France. So I think he'll be the best person to tell us how to manage and how to protect your brand. Over to you, Kaushik sir.
Thank you so much, Srinivas. I think following up on the talks of Dr. KP and Dr. Himanshu is a tough ask. And they've kind of set the stage for what I'm going to be sharing. That once crisis hits, how do you protect your brand? So it's very critical for us to build our reputation. As doctors, I think it's much more critical. And to gain a good reputation essentially means that how do we want to appear to the people who are seeing us? And when we talk of brand, brand and reputation are possibly synonymous for us as doctors here. So these are some pictures. So we need to be very aware, saying that people are not very kind to our profession. So I just pulled some snapshots of clippings of certain crises that have happened in the last few years. And look at how the headlines are. Headlines when there is a general accident, a stampede, or a fire elsewhere, or even when colleagues are being pulled up for certain wrong decisions, it is very rare for them to be called names. But at the same time, whenever something happens in the medical field, unfortunately, I think Dr. KP also mentioned to it, look at all these things. All the four kind of headlines screams botched surgeries. Whether it was really botched, not botched, in their control, not their control, already the guilty or the verdict has been pronounced much before any analysis or any evidence has been collected. And that is reality that we need to live with. When we again come back to brand in healthcare, or for all of us in healthcare, there are two things that are very, very important. One is that the trust that we have with our patients, stakeholders, and everyone else. And second, of course, is the reputation that we enjoy with our customers. Reputation is very hard and time consuming, and it is very, very easy for us to damage. And both of these, especially reputation, reflects how the company exhibits on a daily basis. I pulled this from a book by Philip Kotler, who's considered one of the gurus of management. And I think it is as relevant today as it is 20 years back when he had quoted it. Crisis for us in healthcare is almost impossible to handle. I think it's something that we sign up for when we say that we want to become a doctor. So it's essential for us to plan for the when and not for the if. Now, why is reputation critical? Like I again reiterated, reputation is about how people see you, your brand, your hospital, your clinic, or the organization that you're associated with. A good reputation is very, very useful because it can, one, negate any adverse event that may happen, because patients feel that you are a trustworthy center, you're the best possible, and if things went wrong with you, well, it could have gone much worse elsewhere. But if your reputation is harmed, retaining physicians, doctors, colleagues in your organization, or even staff becomes very, very critical. If your reputation is harmed, well, we all are dependent on patients coming to us. Attracting them becomes a big challenge. For organizations today, a lot of them are looking at venture capital funding, or for institutions such as ours, where we are dependent on philanthropic support. The ability to raise funds again becomes very, very difficult if your reputation is malign. But often we get caught up thinking that the only thing that can go wrong in an eye hospital is possibly an infection. We need to be prepared for a variety of things that can actually go wrong. We can have definitely infections, we can have health outbreaks happening. But yes, we are not immune to violent incidents happening in any of our facilities. Accidents and injuries can happen on campus or in the vehicles that our teams are traveling. In social media, rumors can be pushed out. False information can be pushed up. I think Dr. Himanshu beautifully shared how a poem was construed completely different and people made a mountain out of a molehill for no fault of his. We need to be very, very aware about it. Some of the premium healthcare institutions in our country have been hit with cybersecurity breaches. There can be public relation crisis because somebody has just kicked up a storm on various news platforms. And floods and fires are something that, again, we need to be ready for. For any of these crises, the institution that you are with can get affected, and how are you preparing for it is very, very important. I take the analogy of fire. For a fire to burn, you need the fuel, you need the energy in the form of heat, and you need the oxygen as a catalyst. Similarly, in a crisis, when you or your brand is on fire, obviously the fuel is something that you did or something that people think that you're responsible for. Public opinion is the energy that kind of fans this fire. And the catalyst is the speed or the lack of speed of reacting to it. As with real fires, if you kind of pull any one of these elements out, the fire burns itself out. For us in healthcare, again, it is very, very important that it is not just the patient or the caregiver who are stakeholders, but multiple other peoples, the larger public society, government, media, suppliers, all of them, your own staff, their relatives, because the source of information is formed by the public even before they've experienced it. A majority of people have framed an opinion about us as a doctor or us as a hospital much before they put their foot into our premises. So it's very, very important for us to be aware that multiple other people are forming or are harming your reputation or your brand. At a time of crisis, it's important to engage with these critical stakeholders so that they form a kind of support to you. Again, being transparent, I think everyone has reiterated this. Being extremely transparent is very, very important. You can't cover up. If there is a problem, it is very important to share this information and be open about it. Again, we have to be very responsive. You cannot sit on your back and wait, imagine that it will pass, but actually see what can be done. Again, reputation comes from consistency. You cannot have go on a ChatGPT or a Gemini and say, today I want a good reputation, what should I do? You have to build this over a period of time. How you are perceived as a person takes decades. I think Mohita ma'am shared that after 25 years of practice is when you have, celebrities or doctors or other people who actually value you. So that is very, very critical. And finally, it is a question of alignment of values. How do you align with the organization? So for us at Shankara, if you're not taking care of underprivileged people through our outreach activities, our reputation cannot be sustained because that is who we are. So it is very, very important for us to align this. Again, you don't have the luxury of time. Things go wrong in a crisis. First of all, there is a lack of information to all those involved. There is again a pressure to respond and speculation is rife. You can lose control of narrative because rumors are flying. Everybody is sharing their own version. In any situation, in an accident, on the street, there are 4 or 5 versions. Similarly, when a crisis in a hospital, different people say different things. This gets escalated very quickly in today's world of social media, where instantly it can go across the world and it can go viral for all the wrong reasons. We would be under scrutiny. Today, there is a lack of trust. It is very important for us to bring it back. But in the meanwhile, we have to acknowledge that people will be demanding answers from us. and there will be hostility. Questions will be asked where we would be attacked, and there is a tendency to become either defensive or blame somebody else. And I think we need to be very wary of this and plan. Since this is a postgraduate training program, why should they bother if there is a crisis? They're working in a hospital or a college, it is somebody else's problem. But I think it is very important for them, for you as postgraduates, to remember that you're a part of a team. And before you kind of respond, or you're thinking, should I answer, not answer to the patient or caregiver, these 3 questions will help you kind of understand whether it is important. One, what would a reasonable person expect a reasonable person to do in a similar situation? I think everybody spoke about being empathetic, and Mohita ma'am gave that wonderful example. It's very important for you to kind of imbibe that as a spirit and practice it. Second, if you have made a mistake, you being silent or not being seen to be caring, would that be perceived as a sign of guilt? And third, is somebody else otherwise stealing your narrative and framing the story just because you're quiet? So this becomes very, very critical. Today, you're a postgraduate, tomorrow, you're likely to be a leader. There is global research to show that 45% of a company's reputation and 44% of the company's market value is attributed to the CEO's reputation. So what reputation you build for yourself will almost 50% contribute to your clinic or your organization's reputation itself. So how do you prepare for a crisis? I wish none of us go through this, but if there is a crisis, it's very, very important for us to be clear as to who will respond and what their responsibilities will be. There needs to be checklists for various scenarios. There needs to be contact information readily available in case it needs to be escalated. This could be counterparts in the government, in the police. Like Srinivas said, the previous session is very useful for you as a segue to this. And it's not a bad idea to have some basic templates for media statements or social media posts. You have to nuance it to the situation. And this cannot be something that you do today and it lasts for 10 years. It is an evolving world, so you need to update these templates at least twice a year. We've been through COVID. We've seen demonstrations happen. We've seen ransomware attacks. How would you respond as an individual or a hospital if it happened to you? If you think that this is not your cup of tea, engage a public relations firm. Ask them to come up with a crisis communication plan for you and train your staff in how to kind of respond to it. When you respond rapidly and transparently. Please do not speculate. Have your facts ready. If you don't have the facts, go to the open and say that you're collecting facts and evidence, and you'll come back once you have more clarity. Don't second guess. Always express concern and compassion to the person who's aggrieved. Don't be defensive, and never say no comment. It's nice for others to say it, but in a crisis, when you're at the head of it, saying no comment looks like you're running away from the problem. Again, I quote Warren Buffett, it takes 20 plus years to build your reputation and 5 minutes to ruin it. If you think about it, you will do things very, very differently. Again, to kind of put it all together, I think what the past 1 hour we've been talking about, whenever there's a crisis, it's important for us to take responsibility and own it. Covering up makes it worse. Be proactive and be transparent. Acknowledge the incident, accept responsibility, and apologize. Apologize for what they're going through. Apology doesn't mean to say that we've made a mistake, but apology is a way to empathize with them. Be ready for social media backlash. I think that is something that is bound to happen in today's world. Again, to reiterate, apologize and take action, because a heartfelt apology is key to moving forward. It kind of changes the narrative. The patient is willing to then listen to you. Always monitor what's happening in the media and on social media, because if you find something negative, it could be a simple Google rating where multiple people are piling on. Pull out that person, talk to them one-on-one, and see if you can kind of solve their problem. And often they will kind of go back and post saying that my problem is solved. And very often they are appreciative of it. Seek to understand the situation. Talk to all stakeholders. And if you're still assessing a situation, it is important to say that you're still assessing. And once you have an answer, you will get back to it. Do not give any knee-jerk reaction. Make sure that your team does not communicate and that it is a thought-out response that goes out. Don't fuel the fire. Step back. How would you feel if it happens to you? I think that will, end of the day, ensure that we do the right thing. Again, take this opportunity to share this because I think this is a nightmare for all of us who do high volume surgeries. That what if we have a cluster infection happening? Under Vision 2020, we put together this guideline that has some of these concepts and may be very useful for some of you in kind of responding to such a situation.
Fantastic. Thank you. Thank you, Dr. Kaushik, sir. That was really interesting, and you piled up most of the things. And Harban, sir, and your comments, please.
I think he has really done a wonderful presentation. And what I've been listening, actually, I've been learning actually from all of you because personally, I'm too blunt a person, and normally I talk straight to the patients. But all of us, what we have been talking about, one thing is there that in my mind, I got no fear whatsoever of anything in the life. So that I always convey to the patients, whatever they want to do, whatever they feel like, I'm with them. I'll talk to them. What is said, I'm really sorry what has happened to you. I'll apologize from all the team members. I'm the captain of the ship. I'm responsible for everything, whether it's misbehavior of anybody. I take all these responsibilities. And it should not have happened, but it still has happened. I'm sorry for that. But if they want to go to somebody, send me the flyer, I'm going to send it. I will request you not to send it, but it's, of course, if you do feel like still doing it, you can come and talk to me. But if you still want to send it, I can't stop it. So I'm not saying, no, please, please, please don't do it. Nothing like that. You come, we can talk, but we want to post on a social media, it is entirely up to you. So at the same time, but the only thing I really keep in my life is very clear. I'm not scared of anybody and whatever happens. But I take all the precautions. I talk to them. I'm polite. I'm humble. I'm willing to give them free treatment for life. That all I can take care of. And when endocarditis or something happens, we only charge vitrectomy or something, only charge for the medicines and the equipments used, not the surgeon's fee. So that they also feel it is not totally free. You pay for the vitrectomy cutter, you are given the injections from a center. Next time you replace it because next year some other patient might need it. So we keep on replacing that. But
Thank you, sir. Thank you. So before I hear the last comments from all the three speakers, one important point I think which we need to make or emphasize here to all our young ophthalmologists is there is something called as the spikes protocol for breaking the bad news. So what is spikes? S stand for setting. That is, choose a private, comfortable, and a non-threatening setting to counsel these patients. S stand for setting. Then what is P? P stands for perception. That is, uncover what patient and family think is happening. That is very, very important. You need to try to perceive the things, what is going to happen. Then I stands for invitation. That is, ask the patient what would they like to know, how differently they want it to be addressed. If they're not understanding in a clear way, how in other better understanding we can. So invite them to talk and then listen to their problems. K stands for knowledge. That is, explain the disease, care options in the plain language, as Dr. Himanshu and Dr. KP and Dr. Kaushik very clearly said, is try to counsel them before. Don't trivialize our surgeries. Cataract surgeries is not always been trivialized. Get a phaco done and go and play golf. Was what was the when I learned when I was a postgraduate when the phaco was being done and they said you can go and play golf is the then and then Indian Eyes said get a phaco done and go and play kabaddi. So we are trying to sometimes trivialize our own surgery which should not happen. So knowledge, that is explain the disease and the care option in the plain language. And I like Dr. Himanshu's slide is the most of the 80% of it is pre-op and only 20% of it is the surgical part. Then what is E? E stands for emotion. That is respect feelings and respond with empathy. And S is finally summarize, recap, and decide what's next. So this is the spikes protocol which has been explained very very clearly, especially for breaking the bad news. That is, embrace a patient first approach to advanced care planning conversation. That is a very very important point which I wanted to bring this so that we can complete this whole scenario. So last comments. Yes, Himanshu sir. Please unmute yourself.
Dr. Prashant said something very important in the spikes thing. One more thing should be sharing responsibility. One S cube. Most importantly, sharing responsibility, getting other people involved in the whole game. So you are not breaking the news alone. What Prashant said is correct. Take a cornea guy, get a retina guy, get somebody else. So it's a team which is going to break the news. So you're not taking a single-handed responsibility. Yes, I'm the captain of the team, Urban said. Perfect. You're the captain. But to face a big crowd, which might just become nasty, sharing responsibility and the whole team together answering questions at that time would be a very interesting point. I would say that I would take the take home point would be that. And second, from Urban's, he's not scared of anything. I love it. I love it. I wish I can put that.
No, another thing, so far as this crowd is concerned, I had some patients which I thought may create trouble. So I go and lodge a FIR beforehand, and they give me the beat constable's number. He roams around my clinic. Okay, this guy may come in trouble. Because anything happens, you just call me. I'll be there. So if you feel that somebody can really come and trouble you, go to most of the police officers nearby. You operated most of them. So I go them. They said, "Doctor, don't worry. You take the beat constable's number, and he'll be there."
Yeah, very important point. Yeah, I would just.
Sir, I think this we covered this in the last webinar where our additional police commissioner, he rightly said, is always have a good friendship with your SHO, right? Or here in Karnataka, we call it as the CPI, that is the Circle Police Inspector of that station. So always have a good communication with them. And that is very, very important. It's not that we always, because everybody has the reach with the commissioner, SP, deputy commissioner, or any of those things, or IG, all those things. Always have a very good reputation and have a good rapport with your local SHO. And the beat people who are always coming there, if they are not circulating there, because once we have a good communication with them, they automatically try to take the beat rounds around your hospital or around your house, wherever you feel that you are insecure. I think that was very important point, which sometimes we lack. And nowadays they are also sent circular. The police, he said, they have also been sent circular, like they have to take the beats and they have to go around the hospitals, especially the hospitals which are well known or which are doing good practices and all those things. They also have the list. I was not aware of this. The local SHO, they have the list of the hospitals and where all they need to go, where all they do a beat round, and where all they need to give the protection. They always have it in mind. So I think, as Harban sir said, it's always important to have a good, important touch with those people. Dr. KP, your comments, last comments.
Last word. We really miss Dr. Kirti in this seminar because she had come to Hubli once and we had gathered around 60, 70 postgraduates from different institutions. She had done a dry run or some kind of a role playing for empathy and soft skills. Okay, I think that was one of the eye opener for most of the postgraduates. I think it's now time for the medical colleges, maybe the NMC and also the AAOS for that matter, to do some initiatives regarding this. Is one of the fantastic initiative from ARC. I really applaud and I really all my congratulations to the team for doing such a job. The postgraduates, that is the focus that we need to, so that our future is secure. They can live a very happy and a very safe life.
Thank you. KP sir, I think in our first webinar, we did the role play. So what we are going to do is make these small snippets of these all 4 sessions. Request Prashant sir to please help me in doing that. And once we make those snippets and make your individual talks, and then we are going to put it in our ARC channel. So because the highest viewership is only going to happen after the webinar, not during the webinar.
Exactly.
And I think Dr. Kaushik sir, what do you want to say apart from branding of the hospital and the social media, what you're telling, how you need to publicize even the webinars, what we are doing here, because all might not be attending at the same time, and how we need to build the brand for the webinars. That also you can tell it in a small sentence, please.
I think it's tricky. I'm assuming if you took some of the anecdotes that Himanshu has shared, it's likely to go viral. So that is, jokes apart, most of these topics are not felt. So I'm sure somebody who's in a difficult spot is going to get onto YouTube or get onto Google and say, how do I handle a crisis, or how do I communicate to a patient who's at endophthalmitis, or how do I handle a celebrity? And maybe one of these talks will pop up at that time. I think our role is to make sure that that information is available, and those who find it useful will definitely use it. And essentially, brand and social media apart, I think the title that you've chosen for this, saying that telling tough truths with compassion, the truth and compassion is what essentially all of us as doctors stand for. And whatever you're a brand or anything else, unless you're truthful and honest and you're compassionate, whatever you may spend as a part of your marketing budget or any influencer you get to talk about you, it's just going to be a flash in the pan.
Himanshu sir, you raised your finger. You want to make any one more comment? Any frank comment, because आपने दिल से बात किया है आज. So
Maybe one more anecdote, sir.
we are all listening to it. And
I have a lot of them, but don't put on overall in YouTube certain things. I'm
it's
very
live, sir. This program is live. We can have it after the this thing once the recording stops. I think
the one thing I learned, if you ask me, from Mr. Bachchan, is keeping control on your mouth. You realize how much trouble he goes through. Have you ever seen him in 30 years of my life with experience with him? Never opens his mouth to anything. Never a controversy. He says few words, very emphatic, very clear, no between the lines. He will evade a question. He will throw it away in the gutter. He will ignorance. He will not come online. He will never take on control. Something which everybody has foot in the mouth syndrome. When media asks you a question, everybody loves to amplify and talk. One thing which I learned is always keeping my bloody mouth shut. The trouble is here.
sir, but one point which I think Dr. Kaushik also said, that if we say no comments, then it might also look into adding the fuel. Although you are right and you are doing,
you
but
will
if you want to
justify.
neglect it, sometimes does it do these people take it in a wrong way?
I'm sorry. No. If you have asked to justify, you must justify. You should never hide behind. Talk to the media on their eyes. As I told you, I found it insulting when suddenly that poem came up. I told him on his face. Next day, it had to be reverted. I will not sit quiet if there is injustice. So you must tell, but be careful and choose few words. Don't unnecessarily say anything wrong. Don't go off track. Praise the other person, opposite side. Give your point of view very strongly.
I think the communication has to be fact-based, Dr. Srinivas.
Yes.
You can't speculate or allow speculation. And again, it is very important that you don't point your finger at somebody else just because it's a convenient way to get the problem off your back.
Yes. Teamwork.
you.
Teamwork. I think any trouble
Yes,
creates a crisis line of 6 people, 10 people to be contacted. I have a group in my multiple areas. It's called a 4 a.m. group. If there is trouble, they should respond. I've created that for Bombay Ofthel. I've created for my local club, and it works wonders.
that has who all as the members of that group? You mean the non-doctoral?
So I have a non-doctor and I have a Bombay Ofthel doctors. Like, Bombay, my father is unwell. Suddenly somebody has a heart attack. My family is not traceable. All right. Or my car is stuck. I'm in other part of the city. I write it down. That area, that doctor, all doctors are willing to help each colleague without any questions, with no second sight. But if I don't have any help and I need sudden help, 5 people will run and help me at that time. And that's what we have seen in that club. In that Bombay BOA I introduced last year. Suddenly somebody wanted a passport appointment, got it done. Somebody needs some other kind of help, or a mother has a heart attack, admitted to Leelavati Hospital or Nanavati. One of the consultants would be there.
That's correct.
So do you take guest membership also?
No, we like such people to be there to help us how to go about with things. But this has worked very well with another group, non-doctors group, where a couple of doctors, they get guidance. It happens inadvertently in societies where people talk nonsense, but this is specific and no nonsense forwarding good morning, good evening, this bad, this forward, nothing. Only work and work related, and that to emergency. अभी किसी को हार्ट अटैक रात को wife is concerned, she's a non-medico, the doctor himself has trouble, somebody writes there, believe me, 5 people will help you.
Fantastic.
And it works wonders.
Thank you, sir. Thank you. A salute to all the three speakers and the expert panel for bringing up such a wonderful discussion. Thank you very much. And over to Prashant, sir.
Thank you. Thank you, Srinivas. In fact, let me at the outset thank our past president, Dr. Harbansh Lal sir, for creating this particular platform and this particular profile for ARC and allotting us this platform. Otherwise, we would not have been discussing it. And as KP rightly said, we have to teach our postgraduates, we have to get our future secure. And this initiative was all from our past president, Harbansh Lal sir. And the team ARC is indeed indebted to you for giving us this particular job. And I'm sure that you would be happy that we are doing a
Very great job.
And of course, Kaushik, throughout last two episodes, somehow I missed your name. But yes, for this boot camp, soft skills boot camp, you are one of the brainchild along with Srinivas and Kirti ma'am. Once more, my sincere most thanks for creating such a wonderful program. Seriously, we had a lot of skepticism how we will go ahead. And with your guidance of yours and Kirti madams, we could really come out wonderful. We are getting good reviews for it. And so we would be able to. And besides that, my sincere thanks to KP Bhai, Himanshu sir, and all the other panelists and the speakers who joined us for today's program. So postgraduates, next weekend we are having next Thursday we are having All India Ophthalmological Society. So on that day, that is 3rd of April, we will not be having our postgraduate teaching program. It would be directly on 10th of April when we will be coming with the last episode of this soft skill boot camp, where Dr. Srinivas will be unfolding another new dimension to this particular program. So with this, I think it is time for us all to sign off. Till then, it is bye-bye. Everyone, thank you once more.
Okay, thank you. Bye-bye.
Thank you. Thank you, Srinivas.
Thank you. Thank you, everyone. Thank you. Bye.
Thank you, Harbansh.
Thank you.